Hi, how are you? My name is Atnet. I'm one of the nurses here today, and I'll be doing an assessment for you, okay? A head to toe assessment. And can you tell me your full name, your date of birth?
So my name is Ella Tolda and I was born December 10, 1987.
Okay, very good. And can you tell me today's birth, what where you are right now, and why you're here today?
So today is June 17, 2020. And I'm in Boston and I'm here for the general assessment.
All right, very good. So is that okay with you if I start with the assessment?
Yeah.
Okay, very good. So first, I'm gonna start assessing the client's hair. I'm gonna check for any hair loss, any change or any baldness. I don't see that. Her hair is full, and she doesn't seem like she's losing any hair. So next, I'm gonna move to her face. I'm gonna check for any bruising, any discoloration. I don't see any cyanosis, any redness, any pale color. Everything seems normal. Her face looks symmetrical. So next, I'm going to check her eyes. So her conjunctiva, it is clear, glossy, and moist, and her pupils look even at resting. They look even and round. So next, I am just gonna get my pen light, and I'm gonna check her papillary reaction to the light. So I'm just gonna have you look straight, okay? And I'm gonna grab my light, and I am going to just gonna check to make sure that this is getting recorded. Just gonna move it right here. Sorry. Okay. Okay. So I am going to get my my pen light. I'm gonna see how her pupils are reacting. So just look straight. Okay. Very good. So her pupils are constricting, and I'm just gonna have the light this way. Her eyes are converging, so that's normal. I'm gonna do the same thing on the other side. Her pupils are constricting, and so her pupils seem to be reacting very well to the light. They are, and during when they react to the light, they are both round, equal. They react to the light normally, and they accommodate as well. All right, very good. So next we're gonna move to your mouth. Okay, I'm gonna have you open your mouth for me, please. And I'm just gonna check for any bleeding, any sore, or any lesions. I don't see that. Her tongue, can you stick your tongue out for me, please? Very good. Her tongue, it looks moist and it looks pink, so that's a normal color. And I don't see anything wrong with your mouth, okay? So very good. So next, I'm gonna move to the heart. I'm gonna start listening to your heart. Is that okay? Very good. So I am gonna start at the aortic valve, which is located in the second intercostal space to the right. And I'll be listening to the atrial. Okay. And I'm gonna move to the pulmonic valve, which is located on the second intercostal space to the left. And this is where S2 is heard the loudest. And I'm gonna move to Erb's point, which is located on the third intercostal space. Next, I'm going to move to the tricuspid valve, which is located on the fourth intercostal space. And lastly, I'm going to move to the mitral valve, and this is where we hear S1 the loudest. So for this valve, I want to hear it for a full 60 seconds. So everything sounds normal. Her arteries are here over here on her chest are normal. I don't hear any abnormal sounds. Her S1 and S2 are normal. So S2 is loud on pulmonic valve, and S1 is the loudest on the mitral valve. So I don't have the bell part of my stethoscope, but for this video, I'm just going to pretend that I do. What I'm going to do is I'm going to go to each valve, and I'm going to listen for any abnormal sounds, any murmurs. So I'm going to do that quickly. So I'm going to start at the mitral valve, move to the tricuspid, and I'm going to move to the Erb's point, and the pulmonic valve, And lastly, I'm going to move to the aortic valve. And I don't hear any abnormal sounds, so it sounds very good. So next, I am going to move to listening your heart, okay? And I'm just going to be listening for the sounds, her breathing sound, her lungs on the front part. Then I'm going to go to the lateral sides, and lastly, I'll listen to her back. So I'm going to start here. And for this, I just need you to breathe in and out normally, okay? I'm going to start above her clavicles. Breathe in and out. Breathe in and out. Breathe in and out. Okay, so everything is equal on both sides. I didn't hear any murmurs or crackling sounds. So now I'm going to move to the side. So I'm just going to have your arm up or go up, okay? And then on the right side, I'm going to listen two different places because because on the right lobe on the right lung we have 3 lobes. So I'm going to do that, and I'll move to the left side. So just breathe in and out normally, okay? Okay, and the left side, I'm only going to do it twice because we only have 2 lobes on the left one. Alright, very good. So now I am going to do your back. I'm going to listen to the back of your lungs, okay? And again, I just need you to breathe in and out normally, okay? Alright, you can just straighten out. And while I do this, I'm going to try to avoid putting my stethoscope on the spinal cord or the scapula. Alright. I'm going to listen to the sides as well. So again, I don't hear any crackling sounds, any wheezing, and everything sounds equal bilaterally. So yeah, I haven't noticed anything abnormal. And I'm also gonna start precussing on her back, and I am just gonna place my middle finger on her back, on the lungs, and I'm gonna use my middle finger to tap on the other one. So when I'm tapping on her lungs, I hear resonant sounds, which is a normal finding. But when I do it under her lungs, I should be hearing bell sounds. Good. And I'm going to be checking her kidneys. Do you have any pain over there? No? Any tenderness? All right. And also, I am going to check her chest. I'm going to obviously see if there's any barrow. So everything seems symmetrical. Anterior to posterior is 2-to-1 ratio. So that's a normal finding. So I'm just going to have you bend down, okay? And I'm going to check her spinal cord. And it seems straight. It doesn't have any curve or scoliosis. So that is great. All right, thank you. And also when I check the back of her chest for the lungs, can you breathe in and out for me, please? All right, very good. The diameter seems normal, and my hands seem to be going further away as she's breathing in, and then as she breathes out, my hands are coming together. So that is a normal finding. Very good. All right. So next I am going to have you lay down, please. All right, lay flat, very good. And I am going to, is it okay if I roll this up? All right, very good. So I am going to be starting, going to be looking at your abdomen, okay, your stomach. And I'm just going to inspect, escalate, precuss, and palpate your abdomen. Is that okay? All right, so I'm just going to be checking for any swelling, any bumps, and her stomach looks flat. I don't notice anything. So that is good. And I'm going to be inspecting for any discoloration, any pallor, cyanosis, or any redness. I don't notice any rashes. I don't see any scars, any openings. Her skin seems nice and smooth. So I am going to start listening to your abdomen. Okay, I'm going to be listening for her bowel movements. So I am always going to have to start with the right lower quadrant and work my way up to the left upper quadrant. Then I'll move to the left upper quadrant, and lastly I'll be listening to the left lower quadrant. So I'm going to start with the right lower quadrant. I'm going to be hearing for any vowel sounds. Okay, I hear some gargling over there. And I'm going to move to the right upper quadrant. I hear vowel sounds over there too. Next, I'm going to go to the left upper quadrant. Okay, I do hear vowel sounds. And lastly, the left lower quadrant. And I do hear gargling sounds, so that is normal. But let's say I was not able to hear those, then I would have to listen to each quadrant for 5 minutes until I could hear the vowel sounds. Alright, so that was good. So next I'm going to precuss your stomach, okay? And again, I'm going to follow the same order that I did with when I was listening to her abdomen with the stethoscope. So I am going to precuss, okay? Okay, so that is a normal finding. And on the lower her lungs, the lower quadrants had the tympanic sounds, which is a normal finding, and on top it was jaw sounds, so that is a normal finding. Alright, so next I'm going to start palpating the quadrants, and then you let me know if you ever have any tenderness, any pain, just let me know and I will stop, okay? So I'm gonna start with the right lower quadrant, and there we have the sphenoid colon and the appendix. So I'm gonna palpate. And then I'm gonna move up to the liver and the gallbladder in the right upper quadrant. I'm gonna palpate, and you let me know if you have any pain. Alright. And next I'm gonna go to left upper quadrant, and that's where we have the stomach, the pancreas, and the spleen. And I don't feel any tenderness. And lastly, we're going to move to the left lower quadrant. And here again, I don't feel any tenderness. So did you feel any pain? No? Alright, very good. So I'm just going to have you pull down your shirt. So that was great. So can you sit on the side of the bed for me, please? Thank you. So now I am going to check for her limbs. I'm going to inspect her limbs. She doesn't have any scars, any openings. She doesn't have any discoloration or cyanosis. Her temperature feels normal. And I'm going to check her nails, her fingers. Everything is normal. I don't notice any scarring, any change in her nails. There's no clubbing, any cyanosis. And I'm just going to check your capillary refill by pressing on your nails, and seems normal, everything's coming back in 2 to 3 seconds. And I'm going to feel your radial pulse. Alright, they're normal. And your brachial pulse. Alright, they are +2 bilaterally equal. So nothing is abnormal over here. Next, I am going to, I'm just gonna have your feet right here. Very good. I'm gonna check your legs. So I'm gonna inspect her legs. I don't see any swelling. Both seem equal. There's no scarring. There's no discoloration or any change in pigmentation. And then they both look equal. There's no swelling. There's no edema. So next I am going to inspect the back. Can you lift your feet up for me, please? I'm going to inspect the bottom, and I don't see any ulcers, any lesions, or any openings, any scars. All right, very good. Everything looks good. And I'm going to check between her toes to see if she has any openings, any infection or anything. I don't see that. I'm going to do it on the other side. All right, I don't see anything. And I'm going to check her capillary refill on her toenails. All right, I don't see any abnormality. Everything comes back within 2 to 3 seconds, so that's normal. And I'm going to check your pulse on your feet. Alright, everything is normal and equal, and it's a +2. And I'm going to check your pulse on your papiro, so that is behind your knee. Nice and strong. Very good. And it's a +2. Very good. Nice job. I'm going to have you stand up, okay? And I'm going to have you turn this way. And just have your arms out, please, okay? And I'm going to ask you to close your eyes, okay? Alright. Gonna have her do this for a few seconds. Alright. Do you feel any dizziness or anything? No? Did you feel okay? Okay. And I didn't see her hands or anything shifting, so that is a positive for the Romberg's test. Very good. So now I'm going to check her balance as she's walking. I'm just going to ask you to walk across the room and come back, okay? Alright, very good. Did you feel dizzy or anything? Alright, it didn't seem like she was having any problems walking. She had a good balance. She was moving around okay. Did you have any pains? Alright, so everything seemed normal. And okay, you can sit down. And if this patient was not able to move around, let's say she was in bed most of the time, then what I would do is, can you lay down, please? What I would do to check her back for any pressure, like ulcers, anything, is I would have her turn to the side, and this is how I would be inspecting the back, everything, like on her legs, on the heels. This is how I would check for any ulcers, any openings, or any rashes on her back. Alright, you can come back. Alright, thank you so much for coming today. How was that for you?
It was good.
Alright. And you didn't seem to report any problem or pain. So, okay, thank you so much for coming in today. Alright, do you have any questions for me?
No.
Alright, thank you. So I am going to wash my hands, and I'm obviously going to document the findings, and in this case, everything was normal. So I'll wash my hands and I'll leave the patient's room.